The system that we have it's a patient relationship management service. So if you hear the word or the acronyms PRM coming from Solution Reach, that is what it is referring to. And they really fall into three different buckets: inform, engage, as well as experience. And it does a couple of different things here. So primarily what we're going to talk about is the inform bucket, and there are other applications that come with it. But it does all types of patient communications. So from your standard appointment reminders to your recalls, preventative care and disease management, well childs, patient educations, failed appointments, or perhaps even delinquent accounts. Now, you don't have to use it for all of these, but you can. They're all available to you. And we know each practice is a little bit different, and they're going to operate a little bit different. And so we have these options available to you. And then from an engage standpoint, primarily we're going to talk about what is called SR conversations. That is real-time, interactive, two-way text messaging with your patients. So as opposed to patients calling and asking things like, do I have an appointment? Where do I park? Driving directions. They can actually text those to you now, and you'll be able to respond to them as well. So it's real-time, interactive text messaging too. And then from a SR Pay standpoint, if there's a patient who has a delinquent account and you would like to offer them payment options, you can do that through text messaging. And then the post-care management. So things that are going after scheduled appointments to ensure that they are following the care plan that you have given to them. And then from an experience standpoint, we have patient satisfaction surveys and referrals. We also have online provider review reputation management. So those are other things and applications that we do. So it is a high-level overview of what we do. There is Solution Reach, and there is each of your instances of Epic through the PPOC. That is where the data is going to come from. Technically speaking, it's an API integration. That's something that we will work directly with the PPOC with. Really doesn't affect you there. Just know your data is automatically coming to us. There's nothing that you guys need to do there. You're going to be able to control how you contact them, the time in which you contact them, and then you're also going to control the content of the message. So first and foremost is the contact method. Texting today is by far the most popular way to communicate with your patients. If you all are gathering patients' preferred method of contact, we can honor that. However, texting is the most prevalent here today. We can do emails and we can do phone calls. You will get your best response rate from texting, then phone calls, and then through emails. That's where you'll have your best connection rate with your patients. From a timing standpoint, you're going to be able to dictate when you want these messages to go out. For text and emails, it's actually best to mirror your appointment time, patient conditioning. Phone calls are a little bit different if you're going to do phone calls. 5:30 p.m. to 8:30 p.m. typically works best because they're home, they're after work hours, most likely they can answer the phone at that time. And then from a content standpoint, we have both what is called dynamic messaging and standard messaging available. Dynamic messaging being delivering the specifics and the attributes of the patient and of the appointment in the message. Things like new patients, asking them to arrive 15 to 30 minutes early, bring referrals and insurance information, and a list of medications. Fasting instructions, do not eat or drink after midnight. Driving directions, parking instructions, things that are specific to the patient for the appointment. And then from a standard messaging aspect, that is simply delivering the standard components of the message: date, time, and location. That works best under a phone call scenario and not asking them to remember too much and relying on the text and or email, again, primarily text, to be the referenceable piece of the appointment. That way they can go back and say, okay, here's the date and the time, or here are my fasting instructions, things of that nature. So first we'll kind of review some of the aspects of the messaging, what they look like and things like that. And then we'll have Tim jump right into the platform itself and show you guys how everything works. This is a pretty standard message here. and you'll see in here the date and the time of the appointment. This one has a reply of yes to confirm, or they can call or text from the phone number as well. So a couple things to note here. You can add the date and the time to the message, and they can add it to their calendar and have it pop up as another reminder. They can also take that telephone number and either call you directly, or they can text you now. So if they have a question or something to that effect, they can turn around and text you. So under this scenario, they replied yes, they get a message thanking them for their appointment. Sure.
So if somebody has 2, 3, 4 kids they're bringing in, do they get a separate text message for each kid? This one?
Yeah. So it's a family merging element, and we merge based upon the phone number. A good example here, and we're not going to exaggerate, Paul has 10 kids, and Paul does not want 10 messages. Tim, you have 4?
I have 4, yeah.
4, I have 2, even with 2. So it merges based upon the primary phone number within the data file that we receive. So no, they're not going to receive tons of messages here. Sure.
Whose text number goes and whose
Yours.
telephone?
Yours. It will say your practice number.
Practice number,
Not your number specifically. I'm
Just
sorry.
your number.
Yeah. For all of PPOC clients, we're going to give them your number, your personal number. Okay. No, it will be the individual practice number. And so under this, when you see Alpine Medical, if the patient has the number stored, whatever they have it stored in is what is going to show, just like however you save numbers in your Android or iPhone. If not, if they don't have the number stored, it's going to display the practice phone number.
So we store multiple numbers in Epic. So which field is for patient, home phone, cell phone?
Whatever we're going to determine to be the primary phone number.
And then children over 13.
That should be their primary phone number.
It should be okay.
They should be supplying you that number because
Yeah.
they're the patient at that point.
Okay.
Essentially.
Okay.
Yep. That was another thing that was addressed this morning as well, but
Okay.
that's how it works.
Okay.
Yep. Any other questions? All right. So let's say they do have questions. This is where the conversation piece comes into play. Today, this will be manned by a staff member, and there are applications, desktop applications, where they can reply back. In Q3, this will move from staff man to AI, or artificial intelligence. And so it's automatically going to pick up that message and send a response to the patient. So without human intervention there. So under this scenario, where do I park? Please park in building B. What do I need to bring? Please remember to bring a copy of your insurance card, ID, and list of medications. So no longer is this just a static reminder. It can be a conversation where you engage them and they can answer specifics. And the goal here is to offload those calls coming into the practice for the simple questions that can be answered through text messages as well as through artificial intelligence. Okay. Any questions there?
So you've got an example here. It's text, but if they choose email, if they prefer email, is this message going back and forth through emails?
Email is not that way.
Okay.
Because email, there is such a lag and people have to check emails and things like that.
Okay.
So email is a little bit different. No.
Okay.
So I'll show you that in here in just a second.
That's fine.
But the options through the text messaging, again, add to calendar and the Google Maps. Okay. Okay.
Question, when are we alerted in real time that there's a text message up? So somebody's gonna get that feed across their screen?
And Tim will show you all that, but just think if you have Outlook open and you get a desktop notification that you have a new message, same exact thing there.
Okay. We have another question online. Was there something that tips off the parent to engage in such text conversation?
That depends on how the message is worded.
I see, because I actually sent that message. I was just wondering how, it got to that. I didn't see what was above that example you showed. Where do I park? And, they replied with something, but I was just wondering if the parent or patient actually knows.
That they can reply to it?
Yeah.
Yeah, so part of that is going to be patient education. The other part would be the wording and the scripting of the reply. So something of the effect of, if you have questions, please text us, something to that effect.
Okay, I see. All right, very
Yeah,
good.
and keep in mind, these are not canned responses. They can be custom to prompt those responses too.
Okay.
How does the system know if it's a new patient?
The coding, NP, new, however you're coding a new patient.
Or in, like you're talking for texting?
Yeah.
Sending the message, how do they know it's a new patient with a different dialogue?
Visit type.
Oh,
We don't have them in the system.
If the patient texts back,
Just the initial message where you have,
Bring your stuff.
come 15 minutes early, bring your meds, bring your referral list,
based upon the appointment code.
the appointment
So if you
code.
book them as a new patient, that's how it recognizes it. So that would be tied to a different message than an existing well visit.
Okay.
Yeah, so it's based upon a number of variables.
Okay.
That being one of them. Same thing from how it knows which location they're going to be seen at. If it's a practice from multiple locations, the location code.
Okay.
Was there one other question?
I think so.
Okay. So moving forward, the add to calendar feature, the Google Maps. We generally send appointments in a cadence of 3 weeks prior, 3 days prior, 3 hours prior. This is customizable as much as you like. However, that's where you're going to get your best response and show rate. The 3 hour prior, it's fantastic to deliver the message with the location in which they're going to be seen at. Because we've already learned that Boston is an hour away from Boston. So it's going to give them transit times when they need to get moving to get to their appointment.
And we do have one other question. Is it able to do other languages, for instance, Spanish?
Yes.
Yes, the answer is yes.
So onto emails here for you. Emails are a little bit more static. It's not quite as interactive. Reason being is that requires people to type emails and things like that. But the emails are built from the ground up. They're custom built to reflect logos, color schemes, and themes in the practice. Things you want to display are social media threads, Facebook, Twitter, Instagram, because you certainly want to promote those and have your patients and the responsible parties follow you there. So here you'll see just a quick message when the appointment is. This one only has a confirm option, but it can have a cancellation option as well. Then you have some of the same features of add it to the calendar as well as the Google Map features. Okay. And then you move on to the telephone aspect of it. Yes, we can deliver dynamic messaging here. We like to deliver only the standard messaging components here because asking a patient to remember all aspects of the message is difficult. We want them to rely on a text message or an email as a referenceable source of the appointment. So here we like to deliver the specifics, or I'm sorry, the basics of the message, where they're being seen, the date, the time, and the patient or patient's name. So we take all of that information, we aggregate the responses into reports. And the reports are really robust. They're going to let you know what has transpired in every single message. Confirmed, canceled, left message, number is disconnected or it's invalid, everything that transpires in any of the messages that we send for you. These are available to you not only through our portal, so you'll have access and you can log on if you'd like, but the responses will go back into Epic and update the appointment statuses as well. Okay, confirmed, canceled, and there's some technical things on how those will be handled from the PPOC side, but you'll be able to get the snapshot of what your day looks like directly through Epic.
Will you be able to see in Epic the time that somebody responded to a text or an email?
That one I don't know. That's a Niall question, probably.
Okay.
If it timestamp. Here, yes. Through our portal, yes, and we can provide that information.
Okay.
I don't know that Epic gives that level of detail as a timestamp as part of that update. So maybe. And
That would be helpful.
I don't want to say yes or no and Epic not allow that to go in there. Everything is timestamped in our system.
Yeah.
but I would be making something up if I told you one way or the other. I don't want to do that.
And you're referring to the appointment confirmation.
Correct, yes,
Confirmation, cancellation.
yes.
So for instance, if you had a 4-hour policy and they canceled, an hour before the appointment, would you be able to see that in Epic? So we don't know, we can find out, but you can see it in the portal. So you'll know in the portal what time
But my problem is that if I'm the only one that has access to the portal right now in our existing system, and the problem is that you have people that say, oh, I didn't get the message, or I didn't get it. And you can see, I did a printout here of what we have currently, which says confirm. But in my previous EHR, we had a very specific time beat stamp, and we could say, no, someone at your household answered the phone, and it was a human that answered the phone at 4:25 in the afternoon, and somebody got it, and it was confirmed. So basically, it's a really helpful tool that we've utilized in the past, and we would love to have it come back.
That's great feedback. You're using it for a no-show policy.
Yeah, and just to let people know that we really do know when these systems that you have are really sophisticated and they're really useful, and they're useful to our front staff that are on the phone with these patients that, can make up every excuse in the world why they no-showed for the third time.
Yeah. That's great.
They would do
feedback.
that?
Really?
So you can have multiple users. You wouldn't be the only one that had access to the portal, so that's one thing. But let's find out if it can flow back into Epic, because obviously that's the ideal. But you could have your front desk staff or whoever's manning these messages have access so that they can see it, so you don't have to be the one to go in and look every time if that's what it turns out to be.
What do you do with the list? Is it to backfill or?
No, I mean, basically, when you're dealing with problem patients, that's when you need it. And so front desk doesn't go off into a portal to go look for this stuff in the past. In the previous system that we had, we could just say, oh, you could look and see, somebody answered the phone, somebody confirmed this appointment, and that's how we use it. It's more just sort of catching people because they can make all kinds of excuses.
Yeah.
So Amy and Marta just answered that exists right now with Televox. So it seems likely.
It exists in Televox on the portal, but it doesn't.
Not in
This
Epic.
is what comes over.
Gotcha.
It doesn't exist
Is
in
that from
Epic.
Epic?
This is Epic.
Leslie, it does exist in Epic. If you double click on the appointment from the DAR and it brings up the communication history, you can see the date and time and then the results of what happened from Televox.
Okay.
Great.
I just confirmed it on the I have the Televox portal up and Epic up for one patient. The difference is an hour on the Televox portal, but that's because Televox is in Central Time. But I'm looking at one right now and it's the exact same time.
Okay.
Thank you, Amy.
Do you operate on Central Time like our present?
We operate on your time.
Wonderful.
But the information in Epic is on Eastern Time. It's our time zone.
Yes, so it would convert into Eastern time.
Yep.
So,
We convert it into our time zone.
excellent. Yeah. So the bidirectional interface is standard for Epic. So that will come across them.
Okay.
We did have another question come in. I apologize, my mouse is a little jumpy. Can we send messages with links to other sites like a blog or an article?
Yes.
Yes, definitely.
Yep. New patient forms, if you have those online, articles, American Association of Pediatrics, we've had people do that. So, yes.
So if the appointment is canceled, is it wiped off the schedule in Epic?
That's something we addressed this morning as well. And that is that decision will be made on the PPOC side. There's two options. One is to mark them as canceled and leave them on the schedule. The other is to remove them from the schedule. That's actually an Epic setting, and both are available.
I would believe in them wrong. We got GCF and everything else.
That's not a solution reach.
Amy Amarda is online and she can speak to that. So go ahead, Amy.
Yep. So in current state, we do not remove the appointments. So we do not cancel the appointments within Epic. How it comes over is that the status that you see in Epic is wants to cancel. And we do not cancel the appointment automatically because we want you to see that, and we don't want that appointment to be missed. And what if it was a chronically ill child? All of these scenarios. So the workflow that is intended to be followed is that it shows up on the DAR, it shows up in the confirmation list, it shows up on the appointment desk, all of those areas. And ideally, that column in the DAR is sortable, so you can have staff come in and sort that column on the DAR by confirmation status and see immediately for that day or whatever your schedule is, because everyone is on different schedules. For whatever day you're looking for, group all of those patients that returned with a wants to cancel to immediately work those patients to, one, reschedule them, and two, open up those slots in your schedule. But we do not remove them. That is something that your staff need to know, because you don't want those to turn into no-shows.
Great. Yeah,
Thank
we're
you.
falling to the black hole.
Right. Great. Any other questions on that?
Are you going to go over immediate cancellation?
Meaning?
Like if you have to delete a whole schedule for the day?
Yeah. Great segue. Have you seen this before?
No.
So we had mentioned at the very beginning, not only can you do appointment reminders, but you now have an all-inclusive package that allows you to communicate with your patients throughout the year for various things. Disease management, preventative care, annual exams, recalls, well childs, flu shots, school physicals, failed appointments, satisfaction surveys, and the question here is what we call ASAP messaging, waitlist management, or emergency messaging. And so the system will allow you to send messages on the fly, okay? And there's a couple scenarios here. One is maybe a provider calls in sick, and so you need to cancel appointments for the day. Maybe he or she calls you at 7 o'clock at night. You can initiate that from home. So you'll be able to set all of that up from home. Emergency closings as well due to inclement weather. If it's a closure for the whole day, you can do that. Or maybe it's just a delayed opening till 10 or 11 or noon, something to that effect. You can contact just those patients specifically. So this will allow you to send messages on the fly, on demand, as needed.
They never have weather in Boston though, so that's not a playable example.
Did that answer your question? All right, thumbs up. The other one that we wanted to address here, and Amy, you may want to chime in a little bit, is the recalls. And there are several ways to go about this and the way that Solution Reach can set it up. And Amy, please chime in here, but there is a process in place, I believe, today to run reports and have those uploaded and sent to Solution Reach for recalls for patients who are 6 months, it's seen in 6 months, 12 months, 18 months, whatever the case may be, but that are in need of care. And Amy, I hope I didn't step on your toes and say that all wrong.
No, I think based on the presentation and what came out of the meeting from this morning, I know everyone has been or I shouldn't say everyone, that's a large assumption. A lot of people have been asking about recall functionality within Televox. And Solution Reach offers us the opportunity to go down that road. What we need to explore with Solution Reach and on the Epic side is the best way to go about that with the workflows that are in place in Epic and some availability that Solution Reach has that we just learned about this morning. So I would say it is available with Solution Reach, and how we can make that work is something that we would need to figure out on the project side and then on the vendor side.
Yeah.
Amy, are we talking about like med check management, like the ADHD patients having a med check every quarter and birth control and psych meds?
Well, so right now we only have recalls currently automatically set up for well visits in the system. I think Solution Reach may allow us to expand that possibly. I don't want to be quoted because I know enough. I learned this morning, but may allow us to expand that functionality into ways that maybe works more for the practices along with what you just listed out. Okay. But it sounds like we might be able to. to make your lives a lot easier. That is obviously all of our goals.
So you nailed it, and we're able to set up these dynamic groups moving forward. It's important to note here that we have a really good process in place for implementation and phasing in all of these different services. And the last thing we want to do is say, here you go, and overwhelm you and your staff with all of this. And so we have a really good formula on how and when to roll things out, starting with appointment reminders, getting into the two-way text and conversations, getting into standard recalls, and then from there growing into things like dynamic lists based upon the attributes of the patient and what they need to be seen for 3 months, 6 months, 12 months, and things like that, where patients kind of flow in and out. And so it is a process and it is a journey. But first and foremost is always to get your appointment reminders under control, because that's the hub and that's the most basic and most important here. But we have good processes in place, and what you're explaining falls under the category of our dynamic group messaging.
This would be helpful with HEDIS measures, like the ADHD. You have to, after 30 days on the med, I think you have to have another visit, right?
You do.
And then it's quarterly. And then the HPV vaccines, and reminding people to come in for that second. I mean, there's a lot of things you could do with that.
Are you able to, in that process, when you set up what you call recall or this dynamic messaging, can you individually set up reminders for patients? So if you know you've got a kid that needs that med check, like you were just saying, in 2 weeks, and you've got to customize it, can you do that on an individual basis, or are we talking?
Could you override it?
Well,
Than
we're not
program it?
we don't want to send appointment data because that would be HIPAA, right? So what we're saying is you're due for an appointment, and that's to keep it general so that we are compliant with HIPAA. But we can set, whether it be last completed appointment, or we can look at an actual date that they need to be seen. So that can be individualized as far as the time frame. That makes sense.
Is this not secure, this messaging system?
It's direct messaging.
Direct messaging.
Which means it's not HIPAA compliant?
No, it's HIPAA compliant, but secure messaging means you have to log in.
Right.
So everything is HIPAA compliant.
So, but you could say, you can send a message that says you're due for a med check.
That's correct.
Or you're due for an appointment. Call us to
It's the
schedule.
wording of the message.
Right.
Just like you're doing today, it's just the wording of the message around that.
Okay.
My question to you would be, if a patient needs to be seen in 2 weeks, are you scheduling that appointment?
Well, sometimes people say, they leave the office and then they say, oh, I'm gonna call you later.
That's me.
And then we wanna have a tickler in there that says that it's gonna ping them and bother them until they call us.
100% agree.
So I actually have 2 boys with ADHD, so I know this process unbelievably well, right? They're now 19 and 17, so we've been doing it for a while. But every 3 months they need to be seen, right? Currently, that's all on us. There is no message that goes out. It's like, if we forget or my boys forget, that's on us. We can set this up so that we can look at that recall due date, right? So the date you're putting in the system, and actually have a message going out, because it's looking at that recall due date, but it's also looking forward to make sure they're not pre-appointed. So it's huge for you guys to be able to reach out to these patients. And you can set an individual date for each patient. So my son, my 19-year-old now, by the way, trying to get him to remember to do all this stuff is a nightmare. Anyways, my 19-year-old may have a different schedule than my 17, right? So you guys can actually set that up probably the way you're doing it now, I would guess.
Great.
Yeah.
So we are going to, I love the questions, and hopefully at the end we'll have time for some more, but we really want to get the demo so everybody can see what the product looks like.
Yep, and this, I'm sorry, this was my last slide, so it's a real good segue into what Tim's going to show here in the platform itself and how the interactive messaging and everything works.
Hi, Amy. That's Amy Armada.
That is awesome. Okay, I'll share my screen here.
Perfect.
Okay, so here's the cool part. this is not another system you have to come in and manage all the time, where you're having to do, data exports into, right? So we're going to connect to the data. What I'm showing you, and I'll just kind of go through high level, and any questions you have, stop me. But this would be kind of the home screen, so to speak. So this shows, any kind of recall appointments that are coming in. Maybe if there's a dollar value associated with those, what that is. The schedule. So I think one of the questions was, can we create a group, right? Let's say we needed to close down an office. We could go to that specific location for any given day, right? Let's say the 13th.
In 1 second, Tim, but keep in mind, when you guys log in, you see your providers, your patients, and your locations.
Right. And you can create a group. And now you can send a message out to all those folks saying, hey, we're closed today. So really, it's giving you guys the flexibility to communicate with your patients quickly, easily. Another question that comes up quite a bit is, on the two-way texting. How do people know that they can text a number back? Because they're getting a text from your office phone number. Even though it's not affecting any feature or functionality when it comes to that phone line, it's still your phone number that's showing up. So I have our pediatrician, she's saved in my phone. So if they had solution reach and they sent us a text, it would show Dr. B, All right. You guys want to see the texting in real time? Does somebody want to do it? Does somebody want to send a text? No?
You can text me, Tim.
Okay. Let's see if this works here. So the number I'm going to send a text to is actually my office number. Now we're good afternoon, right? Not food.
Freudian.
It is.
And Paul, I forget the stat, but to the question of how do they know to text back, wasn't it 70% of our clients were receiving text messages, and many of them were unprompted, that people now assume that they can text back as well. So it's a significantly high number.
So we can have as many users on this as you want. We can set permissions. And really the way we're going to roll this out is feature by feature, step by step. It's not going to be, blah, here you go, good luck. It is, let's set up, confirmations, reminders, get that dialed in. And then based on what your needs are, we'll go to whatever's next and most important. So that way we're utilizing the entire system. Something that Drew mentioned that's in the works currently is the AI, right? So let me go back here. Okay, so what's a question you guys get on a daily basis? When's my appointment? Sure. Is that a good one?
And all of that would be completed through artificial intelligence.
Wow, that's cool.
That's neat.
Wow.
If you think about this, this is standard questions you get as we've done our research on this. We feel about 70% of your just day-to-day questions that your staff is fielding are these types of real simple to answer through AI type questions. Where do I park? What time's my appointment? I need to cancel. Those types of things. So it really frees up a lot of your staff time to really have the important live conversations you need to have.
This one will take just a second, but we can actually have a map be set. So, and that kind of goes back to, look how cool that is.
Oh, nice.
Now, again, this is being built, but right now within the two-way texting. Sorry, this is throwing me off.
And when
I've
we
got a
say
little screen.
being built, it's Q3, so it's
Yeah, it's there.
imminent at this point.
What Tim showed you is a live demo, actually. That's actually Sarah, is who we call her, answering those questions. She's still learning. We want to make sure we've got every response and every variation on the ways you can respond before we release it.
And down here at the bottom, you can have, sorry, I've got this thing right here. I need to get it.
You should be able to, do you have a box? Is that what it is? You should be able to shrink it with the little.
Try it. There we go. All right. So down here at the bottom, you can have templates already built out. So if your staff gets, hey, where do I park? As of today, they can just click on something and whatever you guys want will go. So super easy. It's slick. Again, family messaging, that's all done based on the phone number. So if I have my cell phone number with my two girls, because my two boys, I'm done. I'm not taking care of them anymore. But with my two girls, right, if they're coming in for an appointment, I would get one message and it would look something like.
While you pull that up, I believe there was a question.
So we're messaging the parent of the teenagers? That's where it gets confusing because if it goes to the teens, do you know how many teens don't look
They
at
won't,
text messaging?
yeah.
They don't look at it.
They don't tell them about
You
it.
get a teen's phone is 50 unread text messages because what's important is sent through Snapchat.
Yeah, that's
So that's the problem.
so
The parents, we get the young kids in because we talk to the parents.
right.
It's the people that we need to get in. The 12, 13 through 18, 21-year-olds that we track down forever.
Yeah, I know the social media, Snapchat. We had explored that with Boston Children's already in some previous conversations, and I know it's on the docket. But today it's.
I mean, I
text,
guess it
phone
would
call,
just be
email.
education on our end to say you're responsible for your stuff. It's going to come via text.
Or get both phone numbers. Better yet, let's say my boys had me on there,
Yeah.
right? And they also have their cell, and they have an appointment coming up. We both get a text.
Okay.
So all they need to do is just update the account with as much information as possible.
Okay.
We'll take care
Our
of it.
approach as an organization is we're constantly looking at how people are communicating.
Yeah.
The reason we go to text is it's your highest, it's your best response. That same teenager is not going to ever look at an email and never pick up the phone either.
Right.
So text really is the best way, and we are open and are looking and developing as new technologies come. There's some new texting technology that's coming probably in the next year or two. We're already aware of that and looking at how we're going to interact with that. That's RCS messaging and stuff. A few other things that are coming in the future. So one of the things that we've done, we're the first company to ever send out a medical text message 20 years ago, and that was really ahead of the curve. And that's really, we take that responsibility very serious. We are patient engagement. If there is a better way, if Snapchat is the best way to do it, we'll have a solution in the future. I'm not sure it is right now. Again, as we look at that, things have come and gone, but we're constantly looking and developing where are people, where are they communicating, what are patient behaviors, and where do we need to be so you can engage.
Well, I mean, besides a 13-year-old to a 16-year-old, they're not driving. So it doesn't.
Why is that?
But I also agree, anytime when we were first on Epic and we were sending messages to the teenagers as the primary phone number, there were a million notifications.
So my pediatrician's office uses Solution Reach, and I have a 16-year-old, and I get all our reminders.
Well, that's what I was going to say. So for
possible,
clarification,
and
you can get both
Right.
the parent and the kid can
Right.
get the message.
I mean, I get her reminders, I get her happy birthday messages, I
Yeah.
get all of this stuff.
Because you request it or you both get it?
Because we both get it, because
Okay.
they have both our numbers.
Okay.
So we can map all the telephone numbers that are in Epic as cell phones or landlines. So right off the bat, you don't have to have them in the right fields. We just have to have them in there.
Okay.
So we do have another question. Can you set up a text to provide a link with the option to schedule on the patient portal and have the patient book a well visit that way instead of calling us?
Absolutely.
Absolutely. So the answer to that is yes.
And I would recommend it, right?
Yeah, absolutely. Recalls, well childs,
Great question.
school physicals, flu shots, all of the above, where you can prompt them to schedule an appointment. Yes.
Think about it as we're engaging with the patient. Where do you need them to go? Usually portals, my chart, other portals are, the usage is not where you want it, correct? So this is a way to drive people there to do what they
Yeah,
need.
my chart adoption.
Another question?
There was a question about if the appointment was confidential and the patient didn't want the family to see the appointment.
Yeah, so that's where you get into this teenage realm where they can make their own appointments.
Until they get their EOB in 4 weeks, and then you get the phone call from the parent.
Yeah.
It's like,
So the way that we had dealt with it at our previous practice is we had an appointment allocation that was confidential. And so that blocked it from going to anybody except the patient themselves, and the parents couldn't have access to it
On this
And-
product, you were
on this
able to do that.
product.
Yeah.
And we could exclude, right?
Right, you exclude those from reminders at all if you wanted.
We currently do not send any reminder for a confidential visit tape.
There you go.
Thank you, Amy.
No problem.
Any other?
Amy, you're the epic genius, right?
So my title says.
Okay, any additional questions that are coming up?
Do you know when they open your message?
What's that?
When you send a message, do you know that they open the message?
Yes.
Yeah. So-
Time stamped on everything.
So
The question was, do you know when somebody opens the message that you send? And the answer was yes, it will be timestamped.
Yeah, opened or answered, depending on what it is. Yes.
And all this data is kept forever. So it's non-deletable. So you can go back to the very beginning. See, I can keep going back here. And I can see everything that has been sent. That makes sense. So you can always come here and reference any conversation that's happened.
And that's true for the reporting aspect of things as well.
Now, otherwise, they say you never send the message. No, you
That's
receive
right.
it, you open it, and you ignore it.
Or you even confirmed it and you're still telling me.
Yeah.
I don't know if this is an appropriate question. We haven't installed the recall system yet in Epic. So what's the financial cost of all this to a group? And is it per text and messages back and forth, or is it a monthly fee?
25 cents a text.
25
No,
cents?
I'm kidding.
No.
I've heard stuff like that.
Jim's sense of humor is, you know.
Niall, are you still on with us?
I am.
Okay, do we want to answer and talk about everything here?
Sure.
Okay. Yeah, so we've gone through and negotiated some costs for PPOC members. It's essentially per provider billing, and I don't have it up right in front of me, but I believe it's $45 per doctor per month with unlimited messaging. So you can do appointment reminders, conversations, you can do recalls, you can do all type emergency closings. It all falls under that bucket. The AI that's built in is included in that cost as well.
You should be incented to send the right message, not de-incented, right? Or de-incentivized, I guess is the word. So
Your usage, when people start using conversations, our clients start using conversations, it just skyrockets the number of messages they start sending. And so if we were pricing by message, you would not want to use it because you really will have people use it. You will start having conversations. And so we're trying to foster engagement with patients. So let's not put a limitation on that. So if that's the way they want to communicate, they can get everything they need from you.
so that was 45 per clinician,
Yes.
Billing
so
provider.
that's
Per billing provider.
So just to clarify, it's for MDs, EAs and NPs. It's not for
It's service.
social workers,
Correct.
psychologists, et cetera.
And you can still reach out to those patients. Their volume is just so low.
Right.
Or if it's a part-time, we'll just lump them into another provider schedule.
Okay.
Behavioral health. Included in that? Separately, same?
What's their schedule? Do they have a full schedule? Yeah, it would probably fall under that.
The question was about behavioral health providers, and the answer was if they have a full schedule, they would probably be included in that.
Are there other modules that you buy into, or is it just this 45 per month?
There are, those are some optional services here. Things we had,
Delinquent account feature.
that's all a part of this. What is not is things like online provider review, reputation management, and some other ancillary services that we offer, a spotlight feature that we haven't talked about today. And we can certainly go down that path if the time is right and you guys want to explore those, and we have some negotiated rates there. But everything we're showing you today is included in that 45.
So the delinquent account, it would just send out a message saying there's a billing issue that we need to get resolved or some type of message
or
like that.
You could create a group within the system and send them to my chart. You know what I mean?
Okay.
So
And can they respond back, like, prompts and talk to a billing rep or something like that? Yeah, okay.
yeah, this is huge for you guys, being able just to get that message out. I know for me, because not only do my boys have ADHD, but autism, diagnosed at 3.5, roughly 3.5, 4. So we've seen doctors all the time, and I'll tell you, just being able to have that, hey, when's my appointment? I can't remember. Instead of having to pick up the phone, saves me time, but it saves you guys a tremendous amount of time.
And we did have a good question. How will patients be notified when the practices aren't available to text back? Meaning if it must be after hours or something, will they get it? Do you set a time and they get an out of office basically?
Yeah, so basically what happens is, say you close at 5 or 5:30 and they text you at 7, there'll be an automated response that says our normal operating hours are 8 to 5, 8 to 5:30. If this is an emergency, please call 911.
So you can actually customize it down by the day. You can get very, very customized here. I'll log in here so you guys can see it.
Do you have any idea about how much time it will take? It's a lot more hands-on than Televox, other than, the functions are great, and I'm excited about that, but you'll need somebody monitoring it, somebody that has the time to be checking it all the time and responding.
Yes and no, because part of it is it's trading off answering all the phone calls to answering a text message. And then when you move from answering a text message to the AI application, it frees up a massive amount of time at that point. Because we want you to focus on either checking in patients or answering the phone calls for patients who do come in. And so it's a trade-off in time. It's not necessarily more time, because if they're answering a text, that means a phone call isn't coming in as well.
Right, it's just that that's spread amongst a whole lot of people, so now there'll be like a designated person.
Not necessarily.
Depends on how your practice handles
We can
it.
spread that across several
Better,
people as well.
and just anybody answer anybody.
And see, right here, you'll see it pop up. So I just sent myself a text. This is on the web version. The one that's on the PC is much more intuitive. But they're not having to constantly look at this. They'll get a pop-up and then they can just click on it and it takes them right over.
Really, our system is designed to save time.
Right.
At the end of the day, there's training, and that's why we want to have a stepped approach. We don't want to, you've seen a whole bunch of things. We don't want to walk in day one and say, here, learn all this and change your workflows and do all this. That we will release this in a time frame that really works for your practice. But the goal here is to save time, to be more effective and increase your engagement at the same time.
So when is this going to be available?
Great questions.
That's a good question.
Let's do it today.
We're still kind of going through the contracting phase. And then we'll work through the technical phase and the integration with Niall and his team. And then I'm sure come up with an appropriate rollout plan from there.
Is there a time frame that you're looking at?
We're new.
Now.
Right. Someone warned me that might be the answer.
Please.
I think I said yesterday.
Yeah, I think it was yesterday. Yeah.
No, you're giving us tons of time.
Now.
Niall, did you have something to say to that? I thought I heard you.
Well, yeah, I wasn't in the room when we mentioned the cost, so I didn't quite get the reactions. I saw Peter Busius, I think, faint online. I don't know if that was, for a good reason or a bad, but what is your impressions in terms of
Of costs?
cost?
Yeah, I think that people need to compare what they're paying now and then determine if the additional features are worth, if it ends up being more or maybe a cost savings, I don't know. I think all of the practices pay different amounts for Televox, so it's not easy for you or I to say, this is the difference between this product and your product you have now. So people should look at what they have. The people in the room don't seem totally shocked by the price. Is anybody in here totally shocked by it?
I'm not shocked by it. I would prefer to pay for a product that works, and that I'm paying a tremendous amount of labor time right now because Televox is so unreliable that we have our staff manually making phone calls on top of what Televox is doing, and I'd trade that in a heartbeat for this.
I appreciate you bringing that up because in the price comparison, it's hard to do just apples to apples because you will be reducing your staff time, which is serious cost, as well as increasing your volume significantly, exponentially. You'll be using a lot more messages.
And I think no-show rates would improve. And I think if we can reduce no-show rates, you'll find an ROI on that.
No-show rates are huge.
Our no-show rates are considerably higher than what they used to be. They've come down quite a bit because we've worked at it over the last 6 months, but with tremendous outlay of human capital.
Yeah, I think you're really looking at it from the right. Those are the things to compare because those are hard costs.
Yeah, I mean, if you're able to get one patient in for each provider, and even not for each provider, the solution pays for itself, by them showing up.
2 questions I have is, have you done this interface with Epic across the country? And is there a reference similar to a children's PPOC nationally that this has been installed?
Yep. Yeah. With both Epic, yeah.
Yeah.
Yeah, we just finished implementing a multi-state, what are they, about 40 states, a vision practice, and they have about 700 or so practices. And so each practice was set up individually. So we're used to doing this across all the different channels, but especially when it comes to medical. This is what we do. I live and breathe and eat this stuff. So.
And one feather in our cap is we're also the only, on Epic App Orchard, we're the only patient engagement company that's there. So
We do have a question. Is there looking for clarification about the cost and whether there's a separate cost for less than full-time? So is there an FTE cost for part-time providers?
We'll just roll those
into another provider. Okay. So
because their volume of messages is
lower.
Yeah.
Okay. Okay, so it's just about 1 o'clock. Do you have more of your demo? Did you get to show us everything?
Oh no, but there's so much goodness here that.
And keep in mind too, when the time's right, we can work with each of the practices to go through everything to make sure we're talking about the things you want to talk about and move forward correctly. So,
and that's where the customization, we'll customize this to fit your practice, what you're doing, the cadence, and no shows, no shows, not just no shows, but cancellations are a big deal, right? People forget about their appointment and they call and cancel last minute. Let's make sure they get the right message the first time.
Just going back to Niall's
question, I think the price is reasonable, so. And if you're looking for someone to start it, I'd volunteer to be the first one.
Yeah. So I think next steps that the PPOC will finish up the work with Solution Reach. There's definitely seems to be interest. We're thrilled about that. And then, as you know, I will continue to communicate with you when it comes time to start rolling it out. We'll start pulling straws. Who gets to go first?
I get the short straw.
So if you have any other questions, definitely don't hesitate to reach out to me. I did record the session today, so if you have anybody else in your organization that you need to show it to, that you're interested in sharing with, go ahead and do that. We'll share that via the roundup, and then we will let you know as we start to move forward with it. And thank you to my Solution Reach friends for
Thank you.
coming out. And
Thank you guys for having us.
Thank you.
Appreciate the good weather too.
Yeah.
And then those of you online, I do have a couple agenda items that I'd like to go over if you are available. So just give me 1 minute. We'll switch gears here, and we'll just go into our regular meeting agenda.